Hi, everybody. Welcome to GW Center for Integrative Medicine Zoomcast. I'm your host, Dr. Kogan, Medical Director, Associate Professor of Medicine at GW. Today is an interesting topic. I do want to just say a word that I'm sorry I've been absent for a few weeks. The events in Middle East has shaken me quite a bit. I used to live in Israel for years, and I will be bringing potentially guests and definitely be talking about this in upcoming weeks, trying to make some sense and give you some of the way I think path forward may lay. But for now, whatever it is that you feel be doing for that region, or whatever the things that you need to take care of, praying for everybody and hope that will find peace, and for those who died in this horrific set of events, there's no words to express the condolences. So the topic of today is quite interesting. Chronic dyspepsia, or what we sometimes call acid reflux, not an easy condition to manage when it goes for prolonged periods of time. Usually when everybody, at least a couple of times in their life, would have something like this. It may be just for a couple hours, a couple of days, but when it becomes really prolonged for months and years, it's actually a big problem. And the reason it's a big problem more than one reason, but some of the biggest ones is that over time, if you have an excess acidity or lack of acidity in the stomach, digestion starts getting off kilter. And things that can happen, you can have leaky gut, so you can actually have increased permeability that leads to getting things inside the body that shouldn't get in. You may have more food allergies. You may not digest food very well because acidity requires to effectively activate digestive enzymes. So it's a complex topic. Of course, there are quote unquote effective medications for high acidity, which we'll talk about in a second, especially since the actual analysis is related to that, the actual studies we're going to talk about in a second. So, and then of course, it's always a chicken and an egg reality. Is the acidity, is a problem with acidity was first, or is it secondary to some other underlying digestive problem, or excess stress, or eating at the wrong time, or on the go, or just simply eating when you're in stress, and thus you can't effectively digest food because you need to have parasympathetic tone activating digestive system so that everything goes as supposed to. So regardless of the cause, the chronic dyspepsia, what we call it, kind of a more scientific term rather than acid reflux, sometimes it's called GERD, gastroesophageal reflux disorder. But the more common term, dyspepsia, simply defines that, there's a shift in the way acidity is, or a shift to the point that some of it backs up, and then you have this kind of feeling of high acid up in the mouth or in an esophagus burning, etc. So chronically, it's a problem because usually what we do, if you don't go to a holistic doctor of some kind or holistic provider, you'll end up with either taking the older class of medications, something like Pepcid, or it's the older classes. It relates to the way the histamine blockers, versus newer class, which is called proton pump inhibitors, and the most common one is called omeprazole, or the other one something like Protonix, Nexium, etc. So those are considered to be a breakthrough in the gastroenterology for past several decades. The problem with those pills, they're very safe for a very brief period of time, couple of days, couple of weeks, no problem. But the problem is that a lot of people take these pills for years, and they all have 100% side effects. So every single patient who takes the PPIs for years will have side effects, guaranteed, even if you don't feel them. What are those side effects? Loss of bone, increased risk of fractures, increased risk of getting severe infections like pneumonias, Clostridium difficile colitis. Those can be deadly, and mortality from especially Clostridium difficile colitis is somewhere, depending on the studies, from a couple of percentages almost up to 10%, again, depending on how frequent it happens and what the severity of it is. So those can be horrendous diseases. There's an increased risk of kidney failure. and often irreversible kidney failure. And then there's a very questionable, and some people don't think it's real, and it's not really clear from literature, increased risk of memory loss and Alzheimer's disease. Some people think it's linked to B12 deficiency because proton pump inhibitors dramatically increase risk of nutritional deficiencies, not just B12, but other like magnesium, for example. And we see those cases in practice all the time. But the point is, what here is safe for a short period of time is highly unsafe to be taken for a long time. Anybody who's taking these medications for more than a year should really try to get off of them. And I would actually say more than 6 months. And if you can't get off of them, then this is one path you could try. So what we're talking today is the idea that the curcuminoids or curcumin, so the capsules extract, sometimes called turmeric, can actually be used when taken frequently as a method of treatment for dyspepsia. So first, what I'm going to do, I'm going to share my screen, and I'm going to bring up this meta-analysis that was what partially triggered the study that was just published a couple of weeks ago. And I have spoken with, we actually had a meeting with the head of the study, as well as the government representative from Thailand that have organized production of this particular product. We'll talk about all this in great detail in a minute. But what triggered this specific deeper analysis was this Cochrane review. Cochrane, for those who don't know, it's kind of one of the best structure to review and do a comprehensive systematic reviews of a particular topic. So they, some months ago, they taken the point of herbs for functional dyspepsia as an important topic, because again, if something works, it would be way better than use proton pump inhibitors. So I will make sure that the links to all of this is as usual in the description, but this was a pretty sizable assessment, 40 trials, over 4,000 participants. In a total of 27 different herbs were assessed. And if you kind of skip to some of the conclusion, basically what they're saying is the peppermint and turmeric had a reasonably strong data. And then things like all these other herbs here, Nigeria silver, et cetera, sort of like may have some benefit, but it's not very clear. And then actually some like mentha, for example, menthol may actually increase dyspeptic symptoms. But there was a whole actual separate paragraph basically saying in prior small studies, there were 2 small studies of 110 participants, there's may some improvement. So now let's get to the actual study for that specifically I'm analyzing today. So the topic, the study called Curcumin and proton pump inhibitors for functional dyspepsia, a randomized double-blind controlled trial. So the study was done in Thailand. Study was performed on using a standard dose of omeprazole 20 milligrams, which is what usually used once a day, versus curcumin. So the curcumin was produced as a whole extract. It was not concentrated. This is very important. And the main importance for that is that the active terpenoids, so the smell molecules of curcumin, were not removed. And some of them are the same ones that are in ginger. Some of them are quite unique just to curcumin, but it's a very complex essential oils. In essence, that's what they are. The terpenes is a kind of a bit more of an appropriate term, the biologic terms, to terpenoids sometimes, depending on how you use the wording. And so the thinking is it's not 100% clear what worked here. Yes, it's anti-inflammatory. It can support the lining of the gut, but it's probably essential oils that played more important role to control the symptoms. So they've taken 500 milligrams, and they've taken it multiple times throughout the day. So actually taking it 4 times a day. So they took a total of about 2 grams of basically, let's say a teaspoon roughly equivalent of if you eat curcumin as a spice, just putting in your food. So, a pretty good dose. So let's look at what the study design looked like. They enrolled about 200 patients, very good quality enrollment because they started with only 241 patients screened. Everybody had to have proven dyspepsia, so everybody had endoscopy. Everybody had ruled out other causes of dyspepsia like stomach cancer or something like that. And then there was allocation into 3 groups, a random allocation by a standard randomization. Everything was double blinded, so neither patients nor the study team knew what patients were getting. So they were getting either a placebo, and the placebo, there was no pure placebo only group, because otherwise there's no point in doing that, since we know from prior studies that omeprazole works pretty well compared to placebo for acid reflux or for the dyspepsia. So what they did is they combined curcumin with omeprazole, curcumin alone, and omeprazole, but they masked it so that everybody were taking matching placebos at the right times, so that patients couldn't figure out what they were taking. And the capsules all look the same, and all the standardization. There were some dropouts. One of the interesting critiques here, in patients with omeprazole, there were a lot of dropouts. I'm guessing the reason for that is that they could figure out that the acidity changed and they didn't want to be part of it. That's my best explanation for this, although they didn't quite went into it. But the important aspect here, something called intention to treat. So even though these patients dropped out, but the research team did analysis, including those patients into best and worst possible outcomes, giving the trial kind of best possible accuracy of the data. Because if you just simply remove that patients who dropped out from analysis, it's going to potentially dramatically affect the findings. So there's a statistical tool on how to avoid this issue. So at the onset, the groups were relatively equal. There's not much to talk about. Table 1 shows you statistics of making sure there's no differences in the groups before you enter the trial. And so then they use these 2 scales. So one is kind of a more of a actual assessment of the dyspepsia questionnaire that's called short form Leeds dyspepsia questionnaire. And then the other one is a severity of dyspepsia. So it kind of makes sense. You want to assess how is the quality of life affected in a short period of time versus how is the severity of dyspepsia affected. So let's look at the results. So this is what happened. You see the blue line is a combination of turmeric and omeprazole. The red line is curcumin alone, and then green is omeprazole alone. So you can see that everything looked about the same, although combination didn't work as well. So the best give either. But interestingly, when you give curcumin only, the satisfaction score, so the overall severity of dyspepsia actually was the least. And the worst was combination, although at the end of the day, when everything was stopped at day 28, so there only 1 month was given, and then they're just followed. So you can see that at the just patients on turmeric got really quickly better, much quicker than patients with either combination or just omeprazole. And then they did kind of regress to the mean, the term. So basically things are kind of stabilized, but they still stayed a little bit better. So in short, the kind of a conclusion here is that the turmeric given 4 times a day at this pretty inexpensive full extract, nothing really special, seemed to work better than omeprazole, not just for quality of life, but also for severity of dyspepsia. And the effect was maintained after you discontinue it. So you can take it for a month, stop, see what happens. And then if you need to, you can go back and take it again. So they did some other analysis, like they looked at again at the some of the other scores, and everything was consistent. Interestingly, statistical values were not great for things like pain, non-pain symptoms, et cetera. But you would expect only the kind of rough total scale be effective, because this were relatively healthy people, right? So they didn't have a lot of illness. Most of them just had dyspepsia. And by the way, I didn't kind of talk about who they were, but they were middle-aged. Their average age was 50, 49.7, with mostly women. So 70% were women. And of course, they were very uniform, right? So these patients were all from Thailand. There was not a lot of discrepancy in the heritage. So we're going to try to do this study in US. We've approached NIH to try to get a grant for this. I think it would be really important. I think the study is very high grade, large enough, powered well enough. So I think it's going to change practice. Definitely already changing practice in Thailand. I was thinking of bringing the PI to talk to us. His English is actually quite good. But I figured, let me just record this quickly, and then in the future, if I decide to do a kind of a longer meeting with him, longer podcast. But meantime, what do you get out of all of this? So if you are taking PPI and you're saying, I want to get off of it, and you don't want to meet with someone, what you could try to do, you could add at the same time this regular curcumin, literally. And probably I would just take it as a, we don't have this product exactly like this in US because it needs to be imported. I'm trying to get a link. If somebody really wants to buy the Thailand curcumin capsules and have it shipped, it will be available, but the shipping from there will take weeks. We don't know exactly what will happen on the customs. We're going to try to create a distribution center potentially here, but I don't want to deal with this. Hopefully somebody will. But meantime, probably the easiest thing to do is really just buy a regular curcumin, organic, put it in a capsules if you want to do it that way, or just simply take something like a quarter of a teaspoon 4 times a day, mix it with something and drink it. So that probably will work just as well. Although again, we don't know for fact. But you don't have to use expensive extracts. In fact, I wouldn't, because there's a chance that those more expensive products have the essential oils, the terpenoids extracted out. And the thinking is, and this is unique, you're not going to find this in the article, is that those essential oils are probably critical for this benefit. So I'll see you all soon, covering different things on integrative medicine, health, and staying healthy as long as possible. Take care and be safe, everybody.